Well, good evening, everyone. And I just want to just get us started on time tonight because we're going to have a very interesting group of people here tonight. My name is Sheila Green. I represent Parkside Business and Community and Partnership, aka PBCIP, located right here at 1487 Kenwood Avenue in Parkside, Camden. As you can see, I'm multitasking, which is what most Geminis do. We multitask. So, so I'll be doing a little bit of everything. I'll be the host, the director, the questioner, whatever the case may be. Everybody that I have to be tonight. But we start all of our meetings off, welcoming you first, letting you know that all of our guests tonight are part of an informational session. No one is paid for their time here, so their statements are free so that they can speak freely. And we also want to get as much information into the communities as possible. This Zoom is being recorded for future use. So you can always go to our website at www.pbcip.org and you can get a copy of it from there. So we start off normally with just a greeting and a small prayer. And our prayer is basically just to ask for guidance. And that's what we do. So for those that are and into where we are with this, we just want to just give thanks tonight. So dear Heavenly Creators of all universes everywhere, we thank you so much for all of what you have done and what you are doing for us. We thank you for bringing us through 2020 and seeing us through 2021. We're looking forward to 2022 and we ask your guidance as we go forward into this new time period for us. We pray for all of those that are not here, those that are coming. We pray for those in every other state, every other county, every other nation. We pray for all people to be well. We pray for guidance in all of the things that we can do to make things better for their lives. And we thank you for everything that you have done for us thus far and yet to come. In the name of he who was sent, we call him Emmanuel. Amen. Thank you. So still admitting, there's Miss Marianne. And here's Richard. Great. Okay. Hi, Marion. So let's see. So tonight is a very interesting night for us. We're going to have people coming in, and I think I'm in love with Zoom now. I didn't like it at first, but I think I'm getting better to, it's getting better. It's getting better. It's a lot easier than it was before. I'm still learning things. So if you see me moving all over the place, I'm still learning stuff on this thing because it's really like interesting. I'm just trying to get my camera thing down to where I understand what I'm doing here. Recording, polls, chats. Okay. Minimize meeting. Oh, didn't want to do that. Bring all that back. Okay. I'll play with this when I get a chance in the middle. So tonight, PBCIP wants to bring to you the attentions of a few things, as well as the partners that we have had over the last 5 years. Our partners consist of the agencies, HopeWorks, LAIDA, Camden County Historical Society, and the New Jersey Conservation Foundation. Tonight, we also have as one of our guests, Rich Brenner, who is from Rich Brenner and Associates. And Rich is bringing us the Medicare information, seeing that we're being bombarded, those of us that are in the 65-year-old category, that are being bombarded now, and to re-up your medical health care for the state of New Jersey, which is a mandate for the state of New Jersey. So he will be with us also tonight. And we will also have a guest that's going to give us some information on bike trails that are yet to come. I will have the information as for who they are when it's time for them to present. So right now, I'm looking at some people. There's some new faces that I have not seen. Charlene is representing HopeWorks tonight, and she is representing their executive director, Dan Roden. Charlene is also she's an alumni of HopeWorks, Camden native, and now she is an employee at HopeWorks, which is great. That's the way it should always go, which is the best way it should go. But seeing that I see Matt, and I'm not sure, I haven't met you before, or have I?
Yeah, I'm here tonight to present for the bike and pedestrian plan.
You're my bike person. Okay, good. Okay, I was trying to find out like where's my bike person at? All right, great. All right. I see Billy Dupree. Hi, Billy. How you doing? I see Liz Ward. Hi, Liz. And William, I see you.
Hi, I see you. I'm sorry if my head's shiny. I don't have a makeup team here, but
That's okay. I look like, just look at my glasses, it's okay. We're all good.
I'm from New Jersey Department of Transportation, and we're the ones that provided Matt and Liz for the bike plan. So just here to make sure we hear what everybody has to say. So thanks for having us.
Good. Absolutely. I love it. Great, great, great. Okay, so with that being said, there will be more coming in. So let's kick off with tonight with Richard tonight. Because of the fact that, we have a lot going on with this Medicare Advantage. If you're a caregiver out there, if you're taking care of your mom, your grandma, your aunt, a disabled person, or whatever the case may be, especially, you need more information as for this caregiving thing. It's not easy. This is not an easy job. And if you do not need the information, please get a pen and paper. That was my thing I was supposed to tell everybody. Please get a pen and paper tonight. This is information night. This is going to be a lot of information that you need to write down. I'm old school. I don't believe in this video sharing and all that kind of stuff. It's like, write it down so you can remember it, because that's the way you remember stuff. So Rich is going to come to you with a lot of information. Now, I want to introduce Rich to you for those who have never met him. Rich is a specialist in his field. I cannot say too much because I don't want to get him in trouble, and I don't want to say too less and not tell you who he is. I've had Rich on here with us on Zoom at least once or twice, and I've also had him in person at our in-house community meetings, which we normally hold at the Camden County Historical Society, who is one of our guest hosts tonight. So anyway, Rich is going to bring to you information that's regarding this Medicare situation. We're going to break it down this time to get it to an understanding where you're not alone in this thing. This man is a walking wealth of knowledge. He's like the walking encyclopedia of all of this stuff. And he knows the things that we need to know. And he's there if you need to ask him questions. And it would be to your advantage to call him at the end of whatever, if you need to ask questions, to let him guide you into the direction that will be the best for you. Like, he helped me, he helped my mother, my dad, my sister-in-law's mother. We're all in this thing together at this point, and it's just the guidance towards this Medicare Advantage, because it's very confusing. I know that the majority of you have seen somewhere close to, we're just going to throw it out there, 100 commercials in less than 15 minutes on Medicare Advantage between Joe Namath, JJ Walker, and all the rest of the stars that's out there trying to do what they're trying to do. Okay. According to what I was told, you're going to make a phone call and you're going to talk to somebody in not this country. So it is not what we need. We need stuff that's going on right here with us right now. So with that being said, and I'm not going to talk anymore, I'm going to present to some and present to others, introduce to others, Mr. Richard Brenner from Richard Brenner LLC. Please welcome him. Rich, take it over.
Thank you so much. Thank you for the accolades. And Sheila knows that I do this all the time and help people. And part of the concern is everybody, the elephant in the room is the Joe Namath commercial and the commercial for JJ Walker. And you get phone calls. First of all, it's illegal for you guys to get, you as anybody that's Medicare of age, to get a phone call from an outbound phone, somebody calling you without you asking for it. It's illegal. You can answer the phone and say, I'm busy now. Can I have your name and number? And I'll be happy to call you back. And 100% of the time, they will hang up the phone. If you try to call the number back, it goes boom, 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 disconnected. It's illegal for them to do that. So they try to, solicit that way. The CMS, Centers for Medicare and Medicaid Services, don't allow it. What Joe Namath does, and he tells everybody what is out there if you qualify, because they're trying to drive traffic to a phone bank. They're a national company. If you're in Wisconsin, if you're in California, that same commercial is running. They don't know the different plans for the different states. All they're doing is really confusing us. So what there are there programs that are available for different economic levels that will allow you to get things for free. As in the 148.50, there's a Medicare savings program. It calls MSP, Medicare Savings Program. Because you make less than a number, typically about 1,400 as a single, the government will reimburse you the 148.50. It's coming out of your Social Security check. They won't take it anymore. The problem with the government is that the Social Security system, who takes your money and pays you, the Medicare system, which deducts your money, and Medicaid, the three don't talk to each other. Because if you qualify based on Social Security, then Medicare should automatically stop taking the money out. But in order to qualify for the plan, it's not only Social Security, it's other income. So you have to notify them and say, hey, my source of income is X, Y, and Z, my Social Security or pension or whatever. If I qualify, then I can go ahead and get my money back. So I'm going to give everybody a number to call up, and now it's a state program. All it is a phone call and say you qualify for the Medicare savings plan, and they will give you the information over the telephone and either do it with you. If you're computer savvy, great. If you're not computer savvy, say to them, I don't know how to work a computer. Can you help me? And they'll walk you through the application. They're going to then send you the application in the mail because they want your signature on it, because you could say you made only Social Security money, but you could have money elsewhere. So they just want you to sign to attest to what you're saying. That whole process takes about 45 days. But if you qualify for that, there's $148.50, and that's times 12 is $1,800 a year. That's the first thing, just by making a phone call. Secondly, Medicare number, 1-800-MEDICARE. Dial the digits, 633 Medicare. The Medicare number is, I'll tell you in a second. If you dial 1-800-MEDICARE, it's 1-800-MEDICARE, but nobody knows this part. Medicare is open 24 hours a day, 7 days a week, not just 9 to 5 or whatever, like most government hours. You can call them at 2 o'clock in the morning and actually talk to somebody and get your questions answered. Don't call Monday mornings because there's never, you don't get right through. 1-800-MEDICARE is 1-800-MEDICAR. 1-800-633-4227. That's Medicare. The Medicare Savings Program number is 1-800-792-8820. 1-800-792-8820. When you call up, all you say is, I believe I qualify for the Medicare Savings Program. Please help me. And then they'll ask you a few questions, and then you'll qualify for that. There's also another program in the state of New Jersey. All this is free, just nobody helps us get this information. So it just with Sheila's help, getting it out to everybody so you can take advantage of it. The program's called PAD. Some of you may have heard of it. PAD is the Pharmaceutical Assistance Program for the Aged and Disabled. Means if you're over 65 or have Social Security disability for more than 2 years and you're on Medicare A and B, you can qualify for PAD. What PAD allows you to do is go to the drugstore, and no matter what the drug is, the most expensive drug is $7. If you do a 3-month supply, if it's $7, you go to the store once a month, it's $7. But if you have it delivered to your house mail order, then you get a 3-month supply for $7. That's on the most expensive drug. If you have another Advantage plan or a drug plan and you have PAD and the drugs are costing you, some of the drugs are costing you $0, no matter what the most expensive drug is, the most you would pay is $7. They raised the rates from last year, 2021, actually this year, to 2022. They raised the rates to $38,000 adjusted gross income and $45,000 as a husband wife. If you're single, $38,000, which is a little more than $3,100 a month. If you make less than that, you qualify for PAD. It's a free program. You can do it online. Just type in PAAD, New Jersey PAD. Just PAAD should get you there. And the number for them, and like I said, if you don't have a computer, you say the magic words, "I don't know how to work a computer, please help." And they'll help you. 1-800-792-9745. Again, 1-800-792-9745. What that company, what that part of the government will do is help you to get this drug program. Some of the people that when they started with the drug plan, they didn't get a plan because they didn't have any drug need at 65, but all of a sudden now you're paying a penalty because you didn't get it. If you have PAD, the penalty goes away. If you have PAD, there's other benefits. You can change your health insurance plan during the course of the year. You don't have to wait for this October 15th to December 7th open enrollment. Because you have PAD, you can move about the country. You can change the plans during the course of the year rather than waiting. There's a lot of advantages to having PAD, but the drug plan is no matter what drug, and hopefully people aren't real sick, but whatever drug you're on, could be $1,000 or $2,000 a month, would cost you $7. Had a woman in Camden that was on Medicare, was paying the $148.50. She's making $800 a month. Take out $150, she's down to $650, paying $200 a month for insulin. Now she has to have 3 people living with her because she can't afford to pay for anything because all the money's out before she even gets it. Help her, made a phone call, got her the $148.50 back. Made another phone call, got her drugs down to $7. So I gave her almost $350 a month more than she had. There's programs that the government does a poor job of getting to our ears. And people think it's too good to be true. It can't be. There's programs out there that if you qualify for them, you're Medicare and Medicaid eligible. You need Medicare Part A and B. What happens is a lot of people are on Medicare and they have Medicaid, but they never got Part B because when they went to Social Security, they said it's going to cost you money, which is false. If you make below $1,142 a month, the Medicaid door opens up. You can get Medicaid. The $148.50 goes back. You won't have to pay that. You won't pay for any doctor bills or any drugs ever. You get $5,000 towards dental. You get $2,000 towards, you get free hearing aids, $2,000 towards eyeglasses. Every surgery and anything's included. But they also give you $390 to go food shopping and or over the counter at Walmart, Walgreens, CVS. So you also get a catalog for $250 every quarter. It sounds too good to be true. It really is a great thing to have. People just don't know what to do. So when you have only Medicare Part A and you never got Medicare Part B, which would cost you $0, you can sign up January, February, and March. If you don't have Part B already, you can go online. You could call Social Security office. They'll do it for you. You can sign up for it for January, February, March is the open enrollment for July 1st. And then on July 1st, you can have this program that is called a dual plan. Dual because you have both qualify for Medicare and Medicaid. The other real important thing about this is they give you a catalog. You have $250 to spend 4 times a year, $1,000, and that's for durable goods and services. Like if you needed a chair or you needed a blood cuff or a cane or something like that, you have $1,000 a year for things of that nature. You also have a catalog you can give to your doctor. So if you needed to take Ensure or Boost or CQ10 or vitamin D or vitamin C or some item like that, your doctor can write a prescription for you, and now you will get that for free delivered to your front door, in addition to $390 every 3 months, in addition to the book with the $250. What else is really amazing is people that have a caregiver for them, you get a case manager assigned. So if you have a loved one or somebody that's helping you with daily activities of living or helping you around the house or whatever need be, they can get paid up to $600 a week to take care of you. Meaning they got a $31,200 a year job or up to that amount because they're doing what they're already doing. Have two people that are clients in Camden, and the girl was taking care of her mother and lived with her mother to take care of her. So she moved in, had to cut back on her hours. She's now getting $31,200 a year to take care of her mother that she was already doing for free. In addition, they got $390 to go to the food store. They got $250, et cetera, et cetera. All these things are good to get money towards your heating and electric bill. There's so many things that are available that people don't know. So in general, if you have a certain level of income, you qualify for the money give back. If you have a lower level of income, you get the $148.50 back. Plus you can qualify for Medicaid and get a number of options. If anybody has New Jersey Family Care and never got Medicaid, New Jersey Family Care is the Medicaid, but you need to make sure if you have Medicare Part A and have Part B, get Part B, then with the Medicare card and the Medicaid New Jersey Family Care card, those two together get you into the program that gets you everything for free. The other thing about it, if it's too good to be true, the government says you could try it for 1 or 2 or 3 or 4 months. If it's not what you think it is, you can go back to the way you were. So there's no risk. You can try out everything that it says it'll do. And the whole cost to you is zero. There's not a dollar out of your pocket for any of the things I just said. They also give you transportation. If you need to go to and from a doctor, they will pick you up, take you to the doctor, wait with you at the doctor, and take you back for no cost. You just have to give them, you can't do it the day of, you have to call them 24 hours before to schedule it. They'll give you meals when you come home from the hospital. They'll give you 14 meals delivered to your house. They're frozen and you heat them up, but it's a lot better than cooking. There are all the perks that happens, and your care is paramount because they want to keep you healthy. And if you needed diabetes sticks or meters or anything like that, that's all free. So these are programs that are available. Most of them are phone numbers. To get into the Medicare and Medicaid, that program, or to understand the health insurance now, because everybody sees Jimmy Walker and Joe Namath all the time. It's very complex. There's many different companies. I represent every one of them that's out there. Amerigroup, Humana, Clover, Cigna, United Healthcare, Aetna, you name the company, WellCare, I represent them all. It doesn't matter. It depends on what your situation is, which will make the most sense. Some of the plans, if you don't qualify for the Medicare and Medicaid plan, some of these plans will charge you $0 a month, give you $1,000 towards dental. My mom spent $5,000 for hearing aids, and she got $250 back from the company that she had when she was with Medicare before she switched. There's plans out there that you pay $9.99, or some of the plans are $0, and you get the $5,000 hearing aids for either $9.99 or $0. So there's programs that are available. They give you free gym membership. They give you $75 every 3 months to buy over-the-counter things. Aleve, Claritin, Dimetapp, feminine products, masculine things that are needed, toothbrushes, $75 every 3 months. All of it costs $0, and all it is a phone call to me for some of this. But most of the phone calls will be to either Medicare or the 2 other numbers I gave you for PAD and for the Medicare savings plan. With those things in your pocket, it will make everybody should find out if they qualify, which is a phone call. And I don't know anybody doesn't want money. So it just puts it back in your pocket. So Sheila, open it up to questions.
So I do have a question that just popped up. Somebody asked, is PAD available in other states?
Yes, but they don't call it PAD. In
But they don't call
Pennsylvania, In Pennsylvania, it's called PACE. I'm familiar with that, but every state has a program. So it would just be state-run program, depending on the state you're in. Just Google it and it's there. But if you're talking about specifically Pennsylvania, it's PACE, PACE and PACEnet.
Can you put your phone number in the chat so that everybody can grab it?
Sure.
And then that way they can utilize it accordingly. And I know, some of us that's on here are not caregivers or whatever, but share the information if you can, because there are other people out here that's struggling, trying to get their loved ones into programs. Medications are very expensive, highly expensive. And right now, a lot of caregivers are going through, trying to figure out how they're going to be able to pay for these medications. Well, if the PAD program is giving you the opportunity to be able to have a program that's going to offer you, like, prescription drugs up to $7, no matter what, the highest ranking one is $7. That right there is a lot of money that's in, that senior person's pocket, especially when they're on a very fixed income. I mean, they can't go to work anymore. They can't make it. So give the information to somebody else, write it down. PAD number was 1-800-792-9745. Okay. And that way you can share it with someone else that may be in need. You never know. Somebody may just tell you like, hey, I'm dealing with my mom or my grandmom or whoever. And say, yeah, listen, I got a number, man. You can call this number and this can help you, probably with, just prescription drugs. And then on top of that, they may be eligible for some of the other things that they've been talking about. We just don't want our seniors to get trapped in this thing. So, when I bring somebody like Richard on, he's one of the few people that I do actually trust in this industry, because I have seen so much. I used to work for the Senate. I worked with Social Security very closely. And so all of the things that he's telling me, I know are true. So take the information, make sure you get in touch with him. If you're not sure about what you're doing or what you want to do or how to get your loved one put into the program before the deadline dates, put a call into Rich. He will answer the phone. He'll call you back too and email you.
You know it. Somebody had asked about Georgia. So Georgia has what's called a Georgia drug plan. Yeah, they launched it in 2010. Not that I'm smarter than Google, but that's where I got it from. And then you could call that 800 number, and then that's how you do that. So that'll provide somewhat. That they're a little bit different within each state, but they all do pretty much the same thing. They limit your exposure on drugs and take away the penalty.
Thank you, Rich. Thank you so much. I hope that you guys utilize this number. Keep it. This number is a number that, you can use this next year and the year after. His number is the same number. So it doesn't make a difference. Somebody's going to turn 65 sometime or another, like in a few minutes. Somebody's going to turn 65. So they're going to need somebody to guide them through this. And when you talk to Rich, he's got a lot more information that he can give you just besides Medicare. He's also a federal employee specialist as well. So
I put my website up there too. So
there you go. Rich, thank you so much, man. Thank you so much.
Anytime anybody has any questions, don't hesitate. Give me a call, and I can help you, answer you, direct you. It's no problem at all. It'd be my pleasure. Anything I do to help Sheila or anybody has a question anytime, feel free to call me.
Thank you again. Thank you so much.
More than welcome.
So with that being said, we're going to segue over from looking at Medicare and Medicaid, and we're going to go looking at this thing. We got a walk bike. That's the next thing on my list. So I think Matt and Liz and William are all part of this team. So Matt, I just made you a co-host on here. So if you had anything you needed to share, I am so glad I saw that gentleman behind you moving that car, because I could have swore that was like a mechanical thing moving. I was getting ready to freak out. I was like, what just happened? Why is this thing moving behind it? So I made you a co-host so that you can share screen. And you have anything that you want to present. And if you'd like to introduce William and Liz as for their titles and what they do and everything, and then what it is that you're looking for from the audience, because this is recorded, so it will be there for future use if necessary.
Sheila, yeah, I'll go ahead and introduce myself, and then I'll let Bill and Liz introduce themselves. But my name is Matt Ludwig. I am a project manager with the planning and engineering firm NV5. We're located, I'm working out of our Philadelphia office. Sorry about the noise. But we have been brought on board by the New Jersey Department of Transportation to put together an active transportation plan for the city of Camden. And we'll get into the definition of active transportation here in a minute. But Liz, do you want to go ahead and introduce yourself? Liz is part of our planning team as well.
Sure, yes. Thank you everyone for having us. My name is Liz Ward and I work for Susan Blickstein, and we are working on the community engagement piece of this planning process. So
thanks, Liz. And then Bill is from New Jersey Department of Transportation. I'll let him introduce himself real quick.
Yeah, thanks, Matt. I'm Bill Revere. I'm with the New Jersey Department of Transportation and in our Bureau of Safety, Bicycle, and Pedestrian Programs. And the reason why we're here today is we have something called the Local Planning Assistance Program, where towns can apply to help put together a bicycle or pedestrian plan for the city. And Camden applied for that. So they're getting this study at no cost to them. And the reason we're with you here today is we don't want studies that are going to sit and collect dust on a shelf. So, you know, while these guys are experts in bicycle and pedestrian planning and all that, you guys are the experts on Camden. You live there every day. You know the ins and outs. You know why things operate the way they do. So we're really looking to get some of your insights tonight on how things operate the way they are. I think they'll probably run a few ideas by you and see what you think. But the goal is when we put this study together, we want that the people of Camden really can buy into and something that the city can use to actually make improvements and implement recommendations and make it safer and easier to get around. So it's really important we hear from you, and we're so glad that you invited us to be here. So thank you.
Thanks, Bill. So I will go ahead. What we're going to do, we have a real quick presentation that I'm just going to kind of fly through real quick. And then what we want to do is kind of open up the floor. We're going to have some general questions about walking and bicycling in the city of Camden. And we want to hear from you. As Bill said, you are the experts in your part of the city, and we want to get an idea as to what some of the challenges are and what are some ways that we can start to plan to fix those issues. All right. So the way I started out is I mentioned the term active transportation. So what does that mean to people? Well, active transportation is anything that you do to move that is human powered. So simply walking down the street to go to the store or go to the doctor, that is an active transportation movement. Using a bicycle, using a scooter, using a wheelchair. Anything like that is considered active transportation. So we kind of draw this big, broad circle around the different types of what active transportation means. It's mostly walking and biking, but it can mean other things as well. So with putting this plan together, we want to make it so that you feel comfortable and safe making these kind of movements about your neighborhood, or even getting across the city, or even doing something like getting up to the Ben Franklin Bridge and being able to walk or bike across the bridge into Philadelphia, or say to go to Collingswood. We want to create this network across the city so that way every neighborhood is reachable, businesses are reachable, parks, recreation assets, anywhere you might need to go to be able to reach the River Line or the Patco station. I know Ferry Avenue station is probably pretty close for most people on the call, but you may not feel comfortable walking or biking to that, and you know, that limits how many people can get to that kind of asset in the city. So that's what our ultimate goal is with developing this plan, is making it so that folks can walk or bike safe and comfortably across the city. So we're thinking about where people live in their current neighborhoods and thinking about what the destinations are. So schools, places of employment, businesses, parks and open space, transit, like I just mentioned, getting to the doctor. You know, that's an important thing for a lot of people. being able to get to the doctor, and coupling the trip where the bus might be a half a mile away, you have to walk to the bus, you may want to bike to the bus. So we're thinking about not just walking and biking in isolation, but also how can transit be coupled with these trips to get across the city. There are some existing active transportation facilities. Most of Camden has a sidewalk network, but in a lot of places, the sidewalks are pretty old and beat up. There's joints that trip up people that are in wheelchairs or that may be using walkers. And there may not be curb cuts or proper ADA ramps or crosswalks. As far as bicycling goes, there's a few streets in North Camden and Kramer Hill that have bicycle lanes. Closer to Parkside, there are a few trails, but they kind of work in isolation. When they're not part of a bigger network, they serve a recreational purpose right now, but they're not serving a bigger network purpose, and they don't connect you from one place to another. So we want to be able to think of all those things as a bigger network and to be able to get folks from neighborhood to neighborhood across the city. So these are some of the questions I want to get folks to think about is what do you think a successful bicycle and pedestrian plan looks like, as far as where we're creating connections and what are the current barriers? I think when I think of barriers in the city of Camden, I think of things like Route 30 and the Cooper River that really cut off Parkside from the other side from East Camden, that it makes it difficult because the only streets to cross the Cooper River and Route 30 are the very busy streets, and they have high-speed traffic and high volumes of traffic. So that's a safety issue. But we also want to talk about when it comes to crime. Are people concerned about walking and biking because of crime? Are people concerned because of either too much police enforcement or not enough police enforcement? We definitely want to be able to get some feedback from folks tonight on their feelings on that. So this is a vision statement, and I'll call it a starter vision statement that we've put together. And we want to know from folks, ultimately, when we develop this plan, how we can tweak this vision statement to make it fully accurate for the people of Camden. So what we're saying right now is what we ultimately want to create is that walking and biking from home to routine destinations in every neighborhood of Camden is safe, comfortable, and convenient, with easy access to transit and neighboring communities, and to support amenities that make it practical. So I'm going to open up the floor right now. I want to be able to get people, if folks can raise their hand, and Sheila, I'll let you kind of moderate that. We have a few minutes here. I think, Sheila, we probably have about 7 or 8 minutes left in our time slot.
Yes.
But we want to know, in the future, it will be easy to walk or bike to routine destinations from my neighborhood because blank.
Oh, that's a good one.
Yeah, I have my hand raised.
Marion, hi.
Hi.
Hi. So finish the sentence. In the future, it will be easy to walk or bike to routine destinations from my neighborhood because.
I think it would be easier for me, and I do walk, and I found the circuit trail from Farnham Park to Gateway and to Cooper, because that's the areas that I like walking in. But what I had a problem with is that when you leave the Farnham Park and you're walking along the trail to Gateway, there is like a police, a safety station there when you can, alert if there's a problem. However, there's such a long stretch that you're walking, and it's very, it feels very uncomfortable walking as you're going to Gateway, where there's no way that you can alert anyone about anything, especially if you're by yourself. And also, once you leave Gateway and you come around the area where there's Route 130 and the pub, there's a lot of traffic there. And I was thinking about people that might have their children biking around that area there. And it just doesn't seem safe. And I do know that they are building, they have the funds to build a crosswalk around the driving range from the Kane Avenue area to Cooper River Park. So that's going to be good. But right now, it's just that the traffic is really bad trying to get across to Cooper River Park. So it's just the safety right now coming from Farnham Park and going along that long stretch to Gateway that I'm concerned about. And if there could be more safety or police alert areas or something there.
Okay, so we can, that is like an added to, let's solve the problem. But for the sake of doing this, we just want to know, like, how would it be easy to walk from your bike routine destinations from your neighborhood, because in the future it'll be easy for you to do this because there's more police presence, or because the sidewalks will be fixed, or because?
Well, I don't think there should be police presence. I'm just saying a feeling of safety, to make it feel like it's safe, either by some way to contact the police, or just looking at the area to see that what makes someone feel safe
Okay,
walking along the circuit trails.
excellent, perfect.
Yeah,
Thank you.
Marion, I guess a response to that, those are some very good observations. And the good news is that Camden County is moving forward with the improvements that you spoke of. They are going to be connecting the Gateway Park trails behind the pub across Kane Avenue, and then there will be a brand new pedestrian bridge over Route 130, so that Gateway Park will have a continuous trail into Cooper River Park, and then that will also essentially follow the Cooper River all the way into the city, up into North Camden, and then loop around to the Ben Franklin Bridge. So the county is moving forward on what they call kind of the backbone of their network that's going to go right through the heart of Camden, essentially along the Cooper River. So that's the good news there. There's funding being put into things like that. But
yeah, I do know about the crosswalk over from the driving range over across. I think there was $3.2 million that was designated for that over to Cooper River Park. But it's just the feeling of safety along some of those areas there, that it's lonely. I like walking early in the morning, like at 6 o'clock in the morning during the summertime when it's light. And when I walked for the first time, I felt uncomfortable about doing it because, like I said, there's such a long stretch from the beginning point when there is a police alert area and through there. So just the feeling of safety, walking along the trails there between Farnham Park and Gateway, and of course the traffic along Route 130.
Thank you. Thank you so much, Mary. Matt, I have someone in the chat and a question popped up. Wait, I'm getting it back. Okay. Stephanie asks, will the Baird Boulevard crossing help with the safety issues?
yeah, so as a part of the project I just mentioned, there will be a new crossing at Bayard Boulevard to connect the two portions of Gateway Park. So that will definitely, that will help slow traffic down. What we're looking at in the design right now, we also happen to be the firm that's working on behalf of the county on just a separate project than what we're doing right here. But we're looking at the potential of putting in a protected median there so people can look one way. And again, there'll be flashing warning lights for drivers, but they could look one way across, get to the median, look the other way and cross.
Okay,
right.
Is there anyone else that want to answer this question? If you can raise your hands in the chat, we can, recognize you. And if is there another question, Matt?
This was the big one. I guess I don't have a slide for this, but this is, we've been meeting with other neighborhood groups and other folks across the city. And the one question I want to be able to ask folks and get some honest feedback on is about police enforcement. And if people think that, I'm thinking about on the streets of Camden, not the trails, but on the streets of Camden, thinking about if you are walking or biking along the street, is an increased police enforcement because of traffic, people going through stop signs, people going too fast, or other types of crime. Do people think that there is just the right amount of police enforcement, or that there should be more or less? I'd really like to hear some feedback from folks on that.
So everyone heard that. Do you feel as though there should be more police presence in Parkside, Whitman Park, Gateway neighborhoods? At this point, that's what we're talking about. So that, you know, you would feel more comfortable as you walk or bike in your neighborhood. That's the question. So if anyone wants to answer that question, please raise your hand. I'm going to start actually. As I live here in Parkside, I see more police presence here. It's almost second to what's downtown Camden. So because I see so much of it here, walking police, bike riding police, police in cars, police in trucks, I see them all over the place in Parkside. So I think, you know, the lights and the traffic and how it's conducted and how it's slowed down so that, you know, people can't speed through. And we have some people who are what we call totally ignorant to the fact that, you know, a stop sign is actually a stop sign. They just decided they're not going to stop. So if a person is crossing at a green and somebody decides not to stop, you know, even if a police officer was sitting there, they can't stop what's getting ready to happen. But we're looking at other things like in Collingswood and in other cities, there are the crossing little things that just say stop as a pedestrian is crossing the street. Camden doesn't have those. It doesn't have those. I don't see them. They're downtown in various places, somewhere close to like the hospital center, Cooper, you know, I think maybe at Virtua. We just know to slow down at Virtua Lords. But Cooper has them in the city, around Camden, the school areas, the districts, nothing. If you don't slow down for a person, it doesn't even matter because there's nothing telling you have to. So that's one of the issues that I see as for a problem with biking or walking, because a lot of people that are in the city are senior age, like they're not old, but they're walkers. Parkside used to be a walking district. All of the businesses are right here on Hatton Avenue and Kane Avenue, they were. And you could walk from your house to the business and do your business and go home and never drive a car. That's what we were trying to get back to. But now that people are, you know, driving cars and they're driving fast and they're going, you know, whatever they're doing, it's really hard for people to get back into that routine of walking and biking, even though it is happening slowly, but definitely. But it's just a little harder because when you're, you know, disabled or you're older and you can't walk as fast, the light change is important. What timing is on it and everything, that's important. Like if you got a 15-second light and you can only walk 25 seconds fast, you're not going to make it. So that's another, you know, situation that I see. I want to finish the sentence as well. In the future, will it be easy to walk or bike to routine destinations from my neighborhood? Because I can't say that in the future, because for me right now, that's what I do. I can walk and bike from wherever I go. I can walk from here to Virtual without a problem, Virtua Lords on Vesper. I can walk from here to the transportation center, Ferry Avenue. It's very well lit if you're going straight down Hatton Avenue. And then when you turn where the station is, it's well lit there. So that's not a problem. The majority of the area is lit, and PBCIP is working on getting more lighting in the neighborhood because of the fact that the more well lit a neighborhood is, the safer people feel. So we're working on that. It's a 3-year project so far. It's already in the works. We can talk about it afterwards, Matt, if you like. But that's one of the main things, one of the main components of, you know, the walking safety, biking safety. And I see more people are biking than they used to. It's a lot of people biking now. So I think Bridget asked a question, or she made a statement. Let's see. Access from conversation regarding biking in Parkside. The trails are a tremendous resource that should be included in all conversations regarding, okay. So our executive director, CEO, she's also on here. She's probably wearing 20 hats at this moment. So she was just talking about separating the trails from the walking information because the trails are a tremendous resource, she said, that should be included in all conversations. regarding biking and walking, because the trails are one of those things. And I'm so glad that Miriam, talked about them, because a lot of people do not know about our trails. Like, we're one of the few places that has it. So our trails run all behind everything, and we need to expand that. But I understand what she's saying about the safety issue, because there is only one, like, police, whatever, like, station there. However, the police officers are now talking about walking the trails with us, like just having a round the clock circulation of officers walking the trails, like, say, every 2 hours or something to that effect, and they're rotating themselves. So I think if that works out, we'll probably see more people using it. Not to take up no more time.
Yeah, absolutely. And that's where the trails are absolutely a part of the bigger active transportation network. They're almost like the interstate highways of the active transportation network, because they're completely separate from the street. There's limited connections to it. But we're thinking, how do people feel comfortable walking and biking from, say, their front door to that trail, or are they driving to get to the trail because that's the comfortable place to be? But between the front door and the trail, it's not comfortable. So that's the part of the equation we're really working on. Absolutely, the trails are a part of the active transportation network, but we want to make it so that the safety that you may feel on the trail, you're also feeling on your neighborhood street. You're feeling it on Haddon Avenue and the other major cities. I didn't have enough time tonight to get into it, but a lot of the injuries that are reported for pedestrians and bicyclists are happening on those busier thoroughfares.
Exactly.
It's no coincidence that the thoroughfares that have the speedier traffic, like Haddon Avenue being an example, that's where more people are getting killed or injured as pedestrians and bicyclists. So that's a problem, and we're looking into that as a part of the active transportation plan.
On the chat, Liz put the walk bike link so that you could go there for the survey, because that's important that we do our surveys. Surveys are important. I mean, sometimes you get more information. PBCIP uses surveys a lot too, and it helps us to make really sound decisions because we know what people are thinking. We have a color-coded situation, and a lot of different ways that we use that type of thing. So, but the walkbykecamden.com is in English and Spanish. They're doing a public engagement now through November 30th, and they are planning teams and appearances throughout October, November, community meetings, and public information sessions in January. So we're looking forward to this going forward, because in January, when things start to change and, weather changes and everything like that, but having this presentation come out during that time period, because people start thinking about the spring, and they'll start looking at, I want to get out, I want to walk, I want to do something. So that would be helpful. But go to the survey, go to walkbike.com, walkbykecamden.com, and do the survey, find out what other information there is. This is a very great informative thing, especially for the Parkside neighborhood, because of how our city works and how we are able to get around so many different things. Like I said, I live in the middle, so I'm by Baird Boulevard. I can walk from Baird to Vesper, around to Park Boulevard, and back down to my house. That's like almost a quarter of a mile walk, and it's not even really hard when you think about it. So I would advise everyone, this will be up on our website at www.pbcip.org. If you miss it tonight, you can go there, you can find it, and you can take the survey. And that way we can go and do what's good for our neighborhood and complete this transportation plan. I love the idea, and I'm really glad that you guys were able to come on tonight. Matt, thank you so very much. I thank all of the participants that were with us tonight. Let me see if I can get everybody back again. There we go. Thank you, Bill, for being here, and Liz, thank you as well. We will put this up on the website. We have it up on our website already at pbcip.org for them to take the survey, and we have the QR code. We have a QR code. Yeah, we're top shelf. So yeah, please take the survey and respond. You cannot be heard if you do not raise your voice. So make sure you do. Thank you so much, guys. If there's anything else, Bill?
just thank you for having us, and really, I know everybody's always asking you for input and everything, but this is really what makes the project something worth doing, is getting the people who live there their buy-in. So any input you could give us online, it's highly appreciated. So thank you for the time, and thanks for having us.
You're very welcome. Thank you so much. And everybody stay safe. We're going to move right on. And now we're going to present our next guest, which is a part of our awesome foursome, which is our partners with PBCIP. They've been with us now. They've been with us for a while, but they are 5 years as part of the Wells Fargo Regional Foundation grant that we were awarded, if I'm not mistaken, in 2016. I was about to say 19 something. No, in 2016, I think we were 1.25 mil that we were awarded, and we pulled together a team tonight. If I can stand up for a second, I just had to do this. Tonight I'm wearing our shirt. This shirt is old. This is old. This is so old, but this is what our partnering shirt looked like. And our partners we're not calling it in crime, but our partners in cooperation and moving forward: HopeWorks, New Jersey Conservation, Camden County Historical Society, and LAIDA. They are our partners. And tonight we want to start with HopeWorks, seeing that Charlene has been with me since I opened this afternoon. So if you want to take 10 minutes tonight, give an overview of HopeWorks, tell them what you do and everything, and introduce who your executive director is as well.
All right. So first and foremost, good evening, everyone. I am Charlene. I am currently the recruitment and engagement specialist at HopeWorks Camden. So I've been with HopeWorks for just over 5 years. I started out as a trainee in our web development training program, in which we have young people come in every single day starting our program. So we pay them to learn coding, how to build websites, etc. And then once they finish the program, they can get an internship with HopeWorks. All of our internships start at $15 an hour, and they last for 6 months. And then once that internship is up, we move them on to full-time employment, living wage positions, starting at least $42,000 a year. So just to give a brief overview of what HopeWorks is, we are a workforce development and youth development organization here in Camden, New Jersey. We've been open for just over 20 years, and we've served well over 900 young people within Camden, Philadelphia, within the greater Philadelphia area. So again, as a recruitment specialist, I reach out to young people. So a lot of our young people come in through referrals. A lot of their friends and family come in and they take a tour of our facility. And then once they express interest, I get them set up to start. And then they come in, again, they do coding, they learn how to build websites, use Photoshop, and they get paid to do the training. So the training is set up in different modules, and each module contains a certain amount of money, in which that totals up to $1,050 total. So young people get paid that $1,050. And the program itself is up for about 6 to 8 weeks. It is a self-paced training program. So most of our young people finish within 1 month, 2 months, 3 months, etc. And then while they're doing the training, they receive academic support. So for young people who want to go to college, we have scholarships for them that help pay for books, classes, any accessories that they need so that the young people themselves don't have to pay out of pocket. And we also have an ABS program, which is for youth who want to get their high school diplomas. And so we have 2 great instructors that prepare them for the highest exam, which gives them a official New Jersey high school diploma. And then also we give them career readiness support. So we have also career readiness coaches, which provide job readiness preparation. So anything around doing job readiness. So that includes resume building, helping them build a professional wardrobe, mock interviews, and things like that, just helping them to become job ready. And so again, once they finish that training program, while they are still receiving the academic support and the career readiness support, they can move on to an internship, which we have 3 social enterprise businesses. We have our youth healing team, which goes out to do trauma training workshops for professionals within the tri-state area. We have our web development team that creates websites for people, for some of our partners. And then we have a GIS department, which is geographic information systems, that work on pipeline, that help the workers who work on pipelines. They help them, work on maps to pretty much help us understand our world better. And then again, once that 6-month internship is up, we move them on to full-time positions that start at $42,000 a year. We have young people who have moved on to jobs for $60,000, $75,000, $100,000 a year. And these are just pretty much our main goal, is to get them into that living wage job. So that is literally a brief overview of what HopeWorks is. I can go on and on and on about this great organization. Again, I've been here for about 5 years, and so I can go on and on and on, but I know we are on a time crunch. So that is, again, just a brief overview of HopeWorks, and thank you for allowing me to be on this call tonight.
Charlene, that was an excellent presentation. For you to crunch all of that in less than 10 minutes, you did really, really well. I'm so proud of you. But this is something that we would like to know is, how can we get this inside the schools? I mean, I know HopeWorks is doing a lot, so I know they're working with a lot of the students, and I don't think the students are really like aware of some of the projects and programs that HopeWorks actually brings. So is there some way that we can actually get this inside of the school system? We will help you do that in Parkside, especially because we got 4 high schools now, like all of them are here. So why shouldn't we like do this? And we've been trying to get this for a long time so that we can get the young people ready for the next, thing that's going to happen when where technology is concerned. So if there's, some way that we can, work with you, help you guys get this stuff out here. Because I mean, who would not want to start at a $42,000 job, a year job, honestly, So I mean, the only way they're going to find out is like if we help them to do that. But yes, presentation, awesome. It's so much to know. What's the website so that people will know?
So our website is hopeworks.org. And then, from there, our young people who are interested in signing up for the program, there's a simple application online that just requires your name, your address, phone number, etc. Just a way of us getting in contact with them. And then from there, again, once they express interest in getting started with us, I'll be there to help them get started, set up a start date, and from there they can get started. They can get started with getting paid.
Well, we're going to be you and I are going to be in touch a lot. So, you and I, and more than likely, maybe a couple of the possible members from our team, will probably be with that, especially Latina Gaines. She works with a lot of young people. So that would work out for us real well. Thank you so much. Moving right along, and our partners, we are now going to come forward with, how do I start this? Okay, so the Camden County Historical Society has been in Camden City for a while, a very long while. And the executive director there's been a lot of executive directors that have come through Camden County Historical Society. Not until this executive director showed up did we have an opportunity to actually see what this place looked like and what it was and what it can do for us. And what Jack O'Byrne did for us was like open up a whole new door, kind of like giving us like the inside look of what history looks like from the outside in. He has now expanded it to a rain garden that is absolutely beautiful, as well as, we have a garden that's a history garden in the back that has been, put together between the PBCIP team and Camden County Historical Society. There's so much that I could say about it, but I don't want to do that because that's why Jack is here. So Jack, I just want to welcome you and thank you so much. I know you just came in from another meeting. So we would like to ask questions as you introduce yourself and everything. And I just want you to just feel free to like tell everybody about what the society is, what it does, and how it's going to work in the future.
Sure. So we have the historic house on our corner. It's called Pomona Hall. A lot of you probably drove past it, maybe never been in there, but that house is 295 years old. And that was a plantation for what is all of Parkside right now. The Camden County Historical Society merged with the City Historical Society 122 years ago. And that's when a lot of historical societies were created. Basically, it was for the majority to tell their story, and it was about the Industrial Revolution. So much of that was the story this historical society was mostly telling when I got here 6 years ago. It was talking about Camden's Industrial Revolution and rich white Quakers. And it didn't make any sense. We're in a black and brown city. We need to tell everybody's story, especially black and brown, because we want to give people a lot of reasons to come here. A lot of people, I heard wouldn't come here because that has nothing to do with me. And so that's what we've set out to do. And thanks to PBCIP, their funding support through Wells Fargo, and thanks to Sheila, who's been working with us as another one of her part-time jobs. So I think we've made an impact. Let me talk about some of the things we've done over the last 4 years that doesn't sound like what a historical society does, but we're now one of the models for the entire state. And I'll, at the end of this, I'll tell you why. So one of the first things we did was that we took our auditorium and we turned that into the Cultural Heritage Center. And we had a lot of exhibits. We had 25 years of the Anointed. We recently had something on Negro Baseball League. We've a presentation on the civil rights pilgrimage for the 50th anniversary of Martin Luther King's assassination. We created an African American history room. I told you that this place was a plantation, and in the 1700s, there were 14 slaves that were here, and we got to deal with that history. Just the same way Mount Vernon and Monticello, yeah, that is part of our story, and that's something we have to deal with, and that's something we're going to be addressing or honoring next year, and I'll tell you a little bit about that in a bit. But we created an African American history room permanently, and every year we do a different rotating exhibit. And right now we're doing Camden recording artists, especially related to the Philly Soul era. There were so many gold records that are here and came out of Camden related to that history. And there's so much excitement, including the mayor's father, that we're talking about maybe taking half of our second floor of our museum and turning that into a Camden music Hall of Fame. So that's what we're discussing now, maybe doing that for starting next year. We're going to be creating a Latino history room. That's been a stop and start. We really got a setback from COVID, but that's we have the room. We're now going to be working with a couple other partners, including a Hispanic fraternity from Rutgers, Camden, to help us get that going. We have an exhibit on the women's movement. In September, we opened a new exhibit with the Nanticoke Lenni Lenape Tribal Nation with artifacts that were 4,500-year-old artifacts that were found in South Camden. We've repatriated them here, and we partnered with the tribe to honor them. And they're still here, and that's why we call it We're Still Here. Let's see, we've done a lot of things. We have a poetry group that meets here once a month under Sandra Turner Barnes, and that's dedicated to African American culture. Sheila mentioned Parkside History Garden, where neighbors use that. We have 6 raised beds. We have 56 fruit trees. Next month, we're going to be making that handicap accessible. We put up, thanks to PBCIP and Wells Fargo, they put a 56-foot Welcome to Parkside mural in the back of our building. September 11th, 6 weeks ago, we opened up the Castle on the Hill Rain Garden. And so, that's going to be open to the public. That is Parkside's little pocket park. And we'll be doing outside events there. So that's another venue for outside events. We've been partnering with Camden High to restore their baseball and softball fields. And Bridget and I have been raising money to restore the tennis courts. And hope we have about a third of the money, and we need a lot more. And hopefully we can reestablish the Camden High tennis team once again with the new Camden High. And that's something that the athletic director would like to do in March of 2023. We collaborated with the school district for saving a number of the architectural elements for the new Camden High. And I think it was sad that it had to go under, but we were able to save a lot of the elements and reintegrate them into the new Camden High, including the arch. And we were able to save one of the spires that we have in our Castle on Hill Rain Garden. We put up 3 markers along the waterfront in Camden, dedicated to 3 ferryboat locations where they had slave auctions, and that was unknown history. We marked them in cast iron that these atrocities took place here in Camden, and we paid for and erected in September a duplicate marker in Perth Amboy, New Jersey, because Camden and Perth Amboy were the places that slaves were brought into New Jersey because of the proximity to Philly and New York City. We have a branch of the Camden store here. We have a pop-up library on the corner. We were the catalyst, along with Sheila, for creating the Jersey Joe Walcott statue that just went up. We started it, and it got taken away from us. It's on the waterfront, but they're going to give us this black granite thing that's on the waterfront for our Parkside History Garden. So next year, some of the things we're talking about, I mentioned the Camden Recording Artist Hall of Fame. We're working on the tennis courts project, the Latino Room, outdoor events. So we're working on a lot of things, but just yesterday, it's funny that I got a call from somebody at the state, and they want us to apply for this $20,000 grant for a diversity, equity, accessibility, and inclusive consultant to do a plan. And eventually they're going to have all these historical organizations do these plans. And I was asking, well, why do you want us? I mean, we're so far ahead of everybody, but they want to make us an example of what you can do to an antiquated historical society or historical organization. And they want to be able to tout our success. And we look at this as like, okay, we'll take the $20,000 in the plan, but this is a way for us to have continuous improvement and to map our continuous progress in partnering with the neighborhood from years to come, well after I'm gone. So I'm out of breath, Sheila, so go ahead.
You did very well, Jack. You did extremely well. Just like I was saying, we have so much. Parkside is is a living jewel. It's so much history in Parkside. And going to the Parkside, to the Camden County Historical Society, is a treat. That we reopened September 11th. We will never forget it. And that wasn't a pun either. But we opened September 11th to let you back in. There's history on everything that you thought you wanted to know in that place. Just everything you wanted to know was in that place. And then to go through Pomona Hall, to actually walk through rooms where people lived and, raised their children and everything, but also where Black and brown people, more Blacks than in that particular case, were, enslaved in a situation that was right here in Parkside. We hear about it, we read about it, the books tell us about it, and we got videos and stories. But when you walk through it and see it for yourself, it's a whole nother experience. So I would advise you and really recommend strongly that, it's right there at 1900 Park Boulevard. You can't miss it. It's sitting right there. It looks better than it used to because we got this beautiful wrought iron fence around it. Jack worked tirelessly over the summer. I'm serious. Every day he was out there working on the garden. And he put all of the stones that you see in the garden are stones most likely from Camden High School, the original Camden High School. So the pavings that's out there and the turret that you'll see that's sitting over there, that's Camden High School. And there are other pieces out there that's from various other places, because, you know, history is what makes us. It takes us from where we were to where we're going. And if we don't pay attention to it, you know, things will creep up on us, like, you know, this whole environmental thing that's creeping up on us because we didn't take care of it the first time. It's creeping up on us again. But, you know, Jack has made history come alive at the Camden County Historical Society, along with Josh and Bonnie. They are, you know, my co-family, kind of, sort of. And we all work to better whatever it is that we can in Parkside and in Camden County. So, you know, I appreciate you, Jack. I know you had a long day, I'm sure, but thank you so much for everything. And like I said, this is going to be recorded. This is being recorded. So if you guys, you know, if you didn't get it, you can always go back and hear some of the things that's going on, but do yourself a favor, just go over to 1900 Park Boulevard. They do have a membership if you would like to be a member. But if you don't want to be a member, you just like to go in and just read a few of the books that's on the shelves, and it's a lot. My favorite book is the police blotter. It's a big police blotter that's there. So it tells you about all of the police from like all the way back from the 1800s, okay, what they did, who was arrested, who arrested them, what crime they committed, and it's all handwritten. So if that's not enough to get you over there, I don't know what else you need. But Jack, thank you so much. Thanks again. And I'll talk to you soon, okay? Thank you. So we're moving right along. It is now 7:15, and it is time for a PSA. So, ladies and gentlemen, I do PSAs about every, like, right before we go into our next segment. And our next speaker will be tonight. It'll be New Jersey Conservation. So I see Stephanie. Hi, Stephanie. I'm saving what I call the best of knowledge for last, because business is what we really need to know. So Laida, you are on standby. So, but Stephanie, you will go on right after my PSAs. Very short and to the point. We are now going through COVID, and everybody is still going through the vaccines and everything, and more information is being released and other things are being released. And I'm asking you, good night, Jack. I'm asking everyone to, like, you know, be very mindful of the fact that holidays are coming, and you are about to do something you did not do last year. You're about to be in the presence of a lot of people. Family that you haven't seen, friends that you haven't seen, co-workers that you haven't been around. A lot of people are going to be there. So what we would like to do is to just remind you that if you have been vaccinated, that's great. But do not take for granted that your vaccination is to say all do all protector. You got to still wear a mask. You got to still social distance, and you still got to clean yourself, because you don't know where it is. So be mindful of that as you go into all of the holidays when the children are out of school and everything that's getting ready to happen, all the shopping that's about to happen. And be mindful that, you know, the shopping is not going to be as great as it was last year. So I just want to remind you that, you know, we're getting ready to go through another change, an economic change now. Laida may be able to speak on this more than anybody else. Other PSAs going on is Camden County is still accepting applications for rent grants. And I did see Miosha on here from our office, who is our homeowner coordinator. She has been at the helm of making sure that, you know, people are getting these applications in to get grant assistance for their rent. They're still accepting applications for rent grants. The number to call is 856-389-6704, or you can contact PBCIP, who is also assisting with an assistant to Miosha. Her name is, let me get it right, Deja Gibson, at 856-964-0440, extension 14. You can also go to OEO, which is at 856-661-7474, and it will give you program eligibility on what it is that they have. But PBCIP is really working very hard to make sure that, you know, the renters here in Camden who were hit hard by COVID will have an opportunity to be able to stay in their homes through 2022, when this moratorium is going to be crushed and there will be nothing else to be basically said. New Jersey courts, www.newjerseycourts.gov/marijuana. This is as of 7/1/21. The cannabis law took place and took effect of requiring that certain marijuana and hash cases be expunged. So that's one of the things that a lot of people don't know anything about. New Jersey is expunging cases for hash use or hash, I don't know if you want to call it consumption or just having it on you, and cannabis. So you can go to www.newjerseycourts.gov/marijuana, and it's a lot to read, but it's going to be worth it if it's going to help a person get their records cleared so they can go on with their life and get better jobs, et cetera, et cetera. On environmental issues, a couple of Saturdays ago, I had the pleasure of going to a play by Camden's own playwright, Mr. Samir Nichols, who's the playwright, director, and he is the acting director as well. They presented a play called Town Hall, Resolution 50. It is a NIMBY, a not in my backyard situation. The play was done by 4 high school students out in North Camden Park on a nice fall day. And they actually told us everything that we did not know about, environmental injustice. It's one of those things that I couldn't tell you about if I wanted to, and detail it would be all night long. You have to see this for yourself. So I'm sending you to YouTube and put in Town Hall Resolution 50, and you're going to get a snippet of that. And also this Tuesday past, which was yesterday at about 1 o'clock in the afternoon, GMA 3 had come to Camden and interviewed our little team, and actually told them, that they were going to go on their segment of GMA 3 to let people know what it was that had been done here in Camden. This was a play that took about 5 or 6 weeks to put together and then be presented to an audience. And now it's nationally known to the majority of people that have watched GMA 3 and that has been following WHYY, et cetera, et cetera. So that's a very high point. Go to YouTube for Town Hall Resolution 50. PSENG is in Parkside. It's everywhere in Parkside. And they are putting gas lines along the main corridors of the street. So every street has a new gas line, a flexible gas line, but they are now connecting the gas lines to the houses. And they're moving the inside meters that they regas to the outside. So it's coming to the neighborhood near you. We already had it done. I just had my house done yesterday. It doesn't take very long, but it is something that, you have to have done at this point. So when they come, please be ready. It's an indoor-outdoor thing. They use their masks. They're very friendly and they're very helpful. 11/23, Virtua at 1000 Atlantic Avenue will be giving away 500 turkeys starting at 8:30 a.m. That's to all Camden County residents as well as Camden City residents. On the very next day in Farnham Park from 12 to 2, Harvest Fest will be giving away a full meal. It's called a bag and go to residents that come between the hours of 12 and 4. It's one per person, per family. And it's going to it has been sponsored, by the Unity Community Center, Aramark, the Camden Parents Union, PBCIP, the Camden Education Association, with a little help from my friends group, Time for Jumpers, and the Camden School District. So that's going to be on 11/24, day before Thanksgiving. 11/23, 1000 Atlantic Avenue, 500 turkey giveaways starting at 8:30 a.m. for them, and 12 noon for Harvest Fest in Farnham Park. That should take care of just about all of my PSAs for right now. So with that being said, thank you very much. I'm going to go to Stephanie. Hi, Steph. How are you?
Hi.
Good. We're doing this really quickly. I'm loving this. This is going so well. So New Jersey Conservation is one of our partners. And New Jersey Conservation brings that attention to the environment that we don't pay attention to the things that we do and how we do it and things like that. And Stephanie's going to give you an overview, short explanation, 10-minute segment to say just what it is that they do, how they work, and what their future looks like for 22.
Thank you so much. Really happy to be here. I appreciate you giving me a few minutes to talk with you. So New Jersey Conservation Foundation, we're a nonprofit and we do work statewide, but we've been working in the city of Camden for many years. And one of our goals is to improve community access to Farnham Park, in the Parkside neighborhood, by advocating for maintenance, leading and supporting programs for the public, advocating for trail development to the park. So I was really excited to hear the conversation tonight and would love to, support in any way that we can what NV5 is working on, and, on improving bike and pedestrian walkways and trail access, and really those connections to the parks. That's really important. Some of the other things that, we have been working on is like park stewardship and enhancement projects. So that could be like cleanups, trail maintenance, maybe looking at new trails, new facilities in the park. But it's really important to us that we engage with residents in the neighborhood to really make sure that what we're working on and programs and projects are really reflecting what the community wants and what the community needs, and so that you all who are using it, this is in your neighborhood, can really have ownership over that. And I appreciate you talking about, being cognizant that COVID is still out there, and being careful. Over the past year, really in 2020, so much of what we had planned to do, we couldn't do because we couldn't be in person, and that was really hard. So we did shift some programs virtual. We did virtual yoga, which I participated in. I know I appreciated that a lot, to have that opportunity. But I guess starting around June, we were able to start doing some programs in person again this year. Did more yoga in the park, tried to, bring in partners to engage with the community. And so really right now, we're really hopeful for 2022 to develop some new programming. And as I said, I'm really excited to do that survey, that NV5 put out there, and support in any way that we can, really improving the safety and improving trail access and the connectivity of the parks. We do manage Gateway Park. So any connections to Farnham between Gateway and beyond, that's really important to us, and how people are using it and getting there and learning more about that is really important. But we do want to get feedback from you, which I'm thinking probably early in 2022, we can come up with, a survey like was mentioned earlier, or a way to really get feedback from the community about the kinds of programs that you would like to see, and what your hopes and desires are for using the park, what maintenance you see that could be done. I know in the past we've looked at clearing some of the vistas in Farnham Park to see the river, things like that. I also want to mention we did a bird walk in Farnham Park in early October, and we saw 31 different species of birds. And it was so exciting and amazing. There were so many birds, and some of them were migrating through. But one of the things that we're doing is creating almost like a pocket guide that we can give to people that will have, a lot of the most common birds you might see in Camden, in English and in Spanish, drawing a little bit about the species, almost like on a key ring. That's like a little flip guide to get to introduce people to, what you might be seeing in your backyard or in the park that you walk through all the time. So things like that, to really help the community really see there's so many fabulous things, right in your neighborhood and in Farnham Park, and, to really help people see it in a new way and develop, different kinds of programs. And I know yoga seemed to be really popular. So if that's an interest, we can keep doing that, meditation walks, those active kind of things, but also really engaging with, the nature that's right there in the neighborhood.
Awesome, Steph. Awesome. It's kind of funny you should mention birds. When I walk through the park and I go down closest to the river that's on the side going towards Kane Avenue, and where the little house, we call it, that used to sit out in the water, there, that's like the estuary. That's where they all gather.
Yeah.
They all live out there. I've seen egrets. I've seen things that I didn't even know what it was.
Yeah.
You know, and they're
It's
like,
amazing, right?
it's really amazing. They just show up, especially in the spring.
Yeah.
In the spring, they all show up, and you see different ducks and geese that are not the regular ones. They're
Right.
coming in and they're landing on the water, and I'm like, wow, this is amazing. You know that, it actually happens that way. Then, with the trees that have fallen and the trees that have died, some of these animals lived inside of these trees, and some of them actually, had to move and come inland. So
Right.
we see more beavers and things of that nature now
Right.
than we've ever seen, because of the fact that for trees that have fallen into the
Yeah.
water, they have now made dams and stuff with those
Yeah.
trees, and I'm like, this is amazing, because one minute there's nothing there, the next minute there's this dam.
Yeah.
And you see, like, they've been working like a lot.
Beavers
it's
work
really
fast.
crazy.
They really do. Well, maybe in the spring we can do a couple of bird walks during the migration season and see what we saw. I kept a list of what we saw in the fall, and we can compare it to the spring and create
That's
almost
great.
a guide for what you might see.
I think Miriam would probably like that, seeing that she is one of the trail walkers, and that's one of the places that you would see a lot of the birds is along the trails. So that would be awesome.
I can share with you the list of what we saw in the fall, and then we'll go again in the spring. And we have binoculars that people can borrow.
Okay.
And we have bigger bird guides, but the little pocket guide will be really helpful too, because it's smaller. You can stick it in your pocket. And
yeah.
so
That's cool. So I mean, that's one of the things that saved my life during 2020 COVID. If I didn't have somewhere to walk, if I didn't have a trail to walk or something to do, I probably would have just went stir crazy just sitting here in the house, but because I could walk and go out and see nature and watch it change from winter to spring to summer to fall and then back to winter again, and then watch the animals do what their thing is, I was just so amazed to have that, because I didn't really realize how important it was to me then. Now I realize how important it is, so we should all take that opportunity to be a part of it. You have a website, I'm sure, www.
Yes, I can put it in the chat, and I'll put my phone number. So if anyone has, any questions, then you can always give me a call.
Okay, that's great. That's absolutely great. We're grateful for that part of it, because as we were talking about it, you can see things are kind of like tied in together. The walk bike situation, that's tied in with, New Jersey Conservation by way of what they do. So all of that adding in together and getting people out and getting them more active, in communities, as well as, all right, so this is the weirdest thing, Steph. Downtown Camden, okay, this is nowhere near a park. I mean, nowhere. Downtown Camden, I was minding my own business on my way to City Hall. A red eagle just came out of the nowhere and landed on the ground and was walking around like a person.
Oh my God. Wow.
It had to be, I'm only 5'2". It was like right at my mid waist. It was actually at my waist.
Yeah, they're
I was
big.
like, oh my God. And I took a picture of it, but I had to be really far away from it because I didn't know what would happen. But to see something in the city like that was amazing.
They're around and nesting, and that's the thing. It's amazing. And I think you're right. During the pandemic, we really realized how important it is to have those like safe places where you can get outside and continue that appreciation. But I think it helps you to start really paying attention to those things that are around you. It's almost like a meditation, walking, see these things, and then you smell and you hear different things. And but it's cool.
Thank you so much. I see Miss Pat just joined us, and Kyle Smith. Those are my two friends. So Rodney Carter, I see he's joined us too. So we're going to move on, and it is now 7:35. So we're coming to the final stretch. And I thank everybody for staying on with us tonight. I know this was really short notice, like 2 weeks after the last meeting, but we want to bring Laida in because Laida is one of the partners that has helped the job market change, expand, grow, develop into entrepreneurs, do things that they didn't think they could ever do. And the training, because of COVID and other things, forward thinking more than likely, Laida has pushed itself forward into the digital world now. And now you can do Laida from wherever you are, basically. So it's not like you have to go to the place. Back in the day, you had to get up and go. Now you can do what we're doing right now and get the same classes. I'm loving it. But I want to present the executive director, Mr. Ray Lamboy, who has been part of Laida for a very long time. And he's going to explain to you what they do, how they do it, and what's yet to come.
All right. Thank you, Sheila, for having me. And I just want to shout out to PBCIP, the greatest partners we've ever worked with, and the transformation that you guys are bringing about in Parkside is a testament to your hard work and the passion you all bring to the work that you do in the neighborhood. I want to send a shout out to Stephanie. My family and I, we were at the opening of the new Kramer Hill Park, and she was there with binoculars, showing my son and my daughter and my wife birds flying along the Delaware River near Petty's Island. So thank you for spending time with us on Saturday. So LAEDA, Latin American Economic Development Association. So we were started back in 1987. So we're in year 34. Before I joined us here tonight, we were wrapping up session 91 of 91, right? There were 91 classes of our entrepreneurial development training program. Back in 1990, that was session 1. We started this journey of entrepreneurship here in the city of Camden that evolved from just Latino entrepreneurs to everyone. Everybody who has a dream of starting a business, and even more importantly today, building wealth for the next generation. So the theme of our training is really starting to move in that, how do you build a business that you can then build wealth? You can acquire wealth building assets like real estate, like precious metals, like stocks, and so on. And as you accumulate that portfolio of wealth, you can then pass that on to your next generation. So LAEDA started back in 1987 with the unique value proposition of transforming or revitalizing the city of Camden through community-based startups. And what that means to me is somebody who lives in Parkside, who lives on Princess Avenue, walks a few blocks to Haddon Avenue, slips the key in the door of their shop, and they're open for business. And doing that over and over and over again throughout the city. So the entrepreneurial development training program was our starting point, but it wasn't our ending point. So over the 30 years that we've been in existence, we realized that not everyone starts at the same place in their entrepreneurship journey. So we started to create courses that became what we call our continuum of business education. And that is all the way from somebody who's turning a hobby into a business, whether you're knitting little hats for kids to wear on their heads like infants that look like pumpkins, or making candles, or making rubs, or making oils, whatever it is, teaching you how to take that skill, talent, interest, and turning it into a business. And we teach the very fundamentals of business. We talk about marketing, we talk about product development, we talk about quality control. We also talk about in that course two key channels, two basic channels that are within reach of most entrepreneurs: selling at public markets and selling online. We talk about how to crowdsource your PayPal, your Facebook to create a little online commerce presence to start selling your products online. And then we take you up another notch over time. We set some goals with you. We say, hey, if you can reach this amount in sales this year and document your sales properly and claim them on your taxes, we'll move you up to what we call our Quick Start series. The Quick Start series is a more theoretical course where we start to talk about your business plan. Everybody's heard that term, business plan. We talk about the business plan, 2 units of business plan, really overview of the business plan, all the parts of the business plan, what we're looking for, what bankers are looking for, investors are looking for. and then we move into marketing. One thing we've learned over the years is a lot of our clients are passionate about their product or their service, but they just can't sell it to save their lives, right? So teaching them the concept, the science of marketing. See, a lot of people will conflate marketing with advertising and promotion. Advertising and promotion is the display ad, the Facebook ad, the radio ad, the TV spot. Marketing is the science of understanding who your customer is, how they like to be addressed, and where they like to be addressed. What does that mean? That means who's your customer? If I'm a middle-aged Latino male who likes cars, where do I like to get information about cars? Right? Do I get it online? Do I get it in magazines? Do I listen to podcasts about cars? Where is it? And then I buy advertising on those platforms. Okay. So we talk about marketing and how to really hone in on your customer, because you'll hear any graduate, any alumni from our course will always say, everyone is not an answer. Okay. So when it comes to marketing, everyone is not. You might sell one to that elderly person, 65, 85 years old, and you might sell one, but you're going to figure out who your bread and butter customer is, the one that you sell day in and day out. And then we go into credit. Unfortunately, or fortunately, I don't know. It all depends on where you're coming from, right? If you have good credit, it's great. If it's bad credit, it's a handicap. It holds you back. Unfortunately, capital for growing a business is like the air we breathe. It's very hard to build a business on cash, right? So trying to build a business, a little, if I have extra money from my W-2 job, I invest, I grow the business little by little. So credit is a critical part. So we really walk people through how your credit score is constructed, how to read your credit report, and then strategies on how to start addressing those issues. That's our quick start series. And if you set some goals there and you achieve those goals, we'll graduate you to our 9-week course. And that is the biggest investment. So the other two courses were, one was 6 weeks, one night a week for 6 weeks, one night a night for 5 weeks. Our 9-week course is 32 nights over 9 weeks. And this is a major investment on behalf of the entrepreneur, but also on behalf of LAEDA, to really pour into our entrepreneurs everything you need to know about starting a business, whether it's buying insurance, setting up your policies and procedures with your HR, your marketing plan, obviously your business plan, all these different aspects over a 9-week period. That's what we just finished tonight, a 9-week period. So last night was last class. We reminisce, and usually when we do it in person, everybody will bring a covered dish and we'll have a nice little reception and talk and everything. It's a great, community building thing, because they were all strangers on day 1, and now they're all family on day 32. So once you've completed this course, you'll go into our counseling. Our Women's Business Center will take your business plan that you've completed in the course and help you to begin to implement that business plan. Another program that we have is called our Smart Start Capital Fund. And that is using capital as an education tool more than a capital tool. So for those individuals who maybe have some hurt credit, we do small loans combined with credit counseling and additional financial literacy training. And our goal is to get you to go through several cycles to pay those loans back 1 year at a time, to build your credit so that you can go to a bank, whether it's TD, PNC, Wells Fargo, Bank of America, and actually access capital. In that program, we've had about 8 people who have completed the program, gone 3 times, raised their credit score, 100 points. Again, everybody's experience is different. I say 100% of the people who complete their credit action plan, implement their credit action plan, don't get any additional credit, see their credit score go up, 100%. If you don't do those things, it's not going to go up. It might stay the same, okay? We've had about 8 people go on to banks to access over $1 million in capital. So it's very gratifying to see that transformation in our clients, but also to see that individuals who had no chance of getting capital actually getting capital. And we work with them to ensure that investment that they get from the bank or CDFI they deploy it well, and they build their business going forward. In our partnership with PBCIP, we've done a lot of different things. We've done the trainings, we've done some underwriting, some grant programs that we did with M&T Bank and so on. And I'm very excited with the next year or so, our final year, we have some opportunities to get back on track from COVID. We had some really big plans before COVID hit. We wanted to see how we can attract new investors into, had an avenue into the retail stores. And now with the Just for Kids acquisition, I think we have some really great opportunities to do some creative things with that space for our micro businesses in Parkside. So that's a lot of stuff right now, you know, just to give you where we are right now. So Laeta is now bringing this model of work to other communities. So we're working in Atlantic City, we're working in Bridgeton, we're working in Vineland, Woodbury, Mount Holly. We're doing trainings, and we're slowly building the same kind of relationships we have with PBCIP with other stakeholders in those communities. So, you know, we're spreading the word. We've gone digital. So we have all of our courses online, but we will be going back to in-person with some opportunities for online training, because, you know, you can't replicate 100%. Although we've done a good job, it's really incredible. We had our recent graduation in October, just a few weeks ago, where we had 20 some odd entrepreneurs graduate our program. We had 40 entrepreneurs, only 29 were able to attend. Why? Because that whole class was a virtual class. So we had people from Atlanta, Georgia take our class. We had people from North Jersey, New York take our class. So they couldn't make it all the way down to Camden for graduation. So, but it was amazing. They got to see each other for the first time, and like, oh, I thought you would have been taller. You know, that kind of stuff. It was a great thing. But the community that we build in Laeta, it's you're part of the family. You know, we've had people come back from, you know, reach out to us from session 2, 3, needing help, needing assistance, and we're there to help them. And God willing, we'll be there for another 34 years to help all the entrepreneurs that we've helped. So that's what I got.
That's what you got, huh? And you got a lot, man. You got a whole lot. That's more than, I mean, because of you know, agencies like Laeta, you know, the pandemic that hit us with no warning or nothing like that, they were able to help guide some of the small businesses and help them, you know, when it came down to getting pandemic relief funds, so that they, you know, would not go under. You know, their business was their bread and butter. They didn't just jump into a business just because it was a good idea at the time. No, that was to have a life and create a life and do whatever. And, you know, we were grateful for the fact that Laeta was there to be able to assist with a lot of this, to help them to get to where they needed to be. We were grateful for the state to have, you know, a vision to see that, you know, the other entrepreneurs out there in the world, especially small businesses, you know, it was like the Titanic. Instead of the Titanic just sinking like this, it cracked in half and sank. You know, so you didn't even know which side was going down first and fastest. But the fact of the matter is that, you know, between state people like from the state and agencies like Laeta and PBCIP teaming up together and bringing and coming up like a whole saving board underneath of the ship, brought everybody back up to the surface. Because a lot of people did not know their paperwork. They didn't understand what they were supposed to put together. They didn't understand why these were supposed to be put together. They didn't get it, but they were expecting somebody to give them some money so that they could go ahead and continue doing what they were doing. No, they got a twofer, I call it. They got the money, they got the training to learn how to run their business better, as well as getting the funding that they needed to keep their business running. So, I mean, that was a 2 for the price of 1, and now they're still in business. So they get it, and they're doing a whole lot better than what they were doing. So, Ray, I have a question though. Industry-wise, we have a whole new industry that has Grace, New Jersey, okay? And it's one of the most biggest budding industries that there is. So with that being said, you know, Laeta has been the training program to get people ready for their own entrepreneurship, but the cannabis business is here. It's here, it's growing, it's in Camden, it's coming to Camden. A lot of things is about to change. Can Laeta help what we call our legacy teams, the people that have been in the streets trying to run businesses from their streets, become what you call legal people as for legal businesses and how will we support that?
We're in a very interesting dynamic because we receive federal funding for our programming. And because federal government still considers marijuana a class A or whatever they call it,
Yes.
nonsense, illegal. We were not allowed to help marijuana businesses. We're not
Okay.
allowed to provide technical assistance and so on. That's
Yeah.
one part of life. The other part is not funded by the federal government. So we can't use the Women's Business Center to do that. I'll just say that.
Right. Okay.
But we're looking. I'm looking at opportunities to see how we can thread that needle. But whether you're selling shoes, clothing, marijuana, the fundamentals are the same. It's your product, your marketing, and your administration, right? So whether you're, like I said, if you're going to be a dispensary, that's like a retail type business, you're gonna have marketing, you're gonna have product development and production, you're gonna have bookkeeping. And I think with the marijuana business, bookkeeping is a big thing. I mean, I think from Colorado, it's like armored car services are a big deal out there, right?
Yes, it
Because
is.
and you can't deposit money into the banks, right? Because it's federal government. So there's a lot of dynamics that are unique to the marijuana business, the cannabis business. But like I said, the fundamentals are always the same. So as far as the regulations and legalese and all that kind of stuff, I'll leave that up to the experts. But if you want to understand the basic fundamentals of running a business, yeah, we're here to help you. We've done courses like Food Trucking 101, which is very specific to the food industry. We actually have a course right now. We're in partnership. We're in our second year with Santander Bank to cultivate small business, where we're helping growth stage food entrepreneurs create growth plans. It's a 9-week course. It's actually a 10-week course starting in April next year, where it's all virtual. You get all this food industry training. You get a grant at the end of the course if you complete all the requirements, and then you can get into a competition for a $10,000 grant. So if you want to go to our website, liada.com, we got .com before there was .org and so on and so forth. So, but we still own .org. Marketing, that's a marketing suggestion. Buy all the domains of your name. .org, the .net, the .co, so nobody can take your username. That's an IP kind of thing. But yeah, go to the site. If your favorite takeout restaurant that you've been using during COVID, and they do a great job and they're really rocking and rolling, send them to our website. Have them sign up for the course. It's amazing what the alumni of this course have achieved from we've got ice cream parlors and restaurants and cookie makers, candy makers, all kinds of people that take this. Even microbreweries have taken the course.
Wow.
And it's put on by a powerhouse of partners. Babson College is responsible for the curriculum. They're out of Massachusetts. ICIC is one of the major partners. They're a major economic development organization, a national organization. Obviously, Santander Bank. So it's a very powerhouse course, which is only good for those who've already started their business, have been on business for at least a year, and have at least $25,000 in revenue. So that's the key. But I tell everybody, hey, what was your favorite restaurant during COVID that you got takeout? Let them know about it. Tell them about it. Maybe it may be good for them to get back on their feet. That kind of stuff. We are recruiting for our WBA, our Women's Business Academy, which is going to be starting in January. There's an application process. Go to our website. That is the 9-week course, but directly for women. Now, again, we don't discriminate. The guy wants to take the course, he can take the course. More than welcome to take the course. But we really focus in that course around the unique challenges of women entrepreneurs. That they have the competing priorities of being, wife, mother, caregiver, partner, all these things, and starting a business, right? So there's the priorities, and then there's negotiation skills and knowing your value. So a lot of our instructors are all women, and it's a very safe place for women entrepreneurs to talk about not only their goals as a business owner, but their goals as women and the challenges that they face. So The Women's Business Academy is coming up. Like I said, go to our website, fill out the form. Somebody will be in touch with you to interview. You do have to interview for the course to be accepted. So, keep that in mind. Then we have our calendar of events, very robust events during the 2022. Lots going on. So, find what's good for you and plug in. So
That's so cool. That's a lot of stuff. I mean, it's a lot of information. I would advise everybody that's on here, and when you see this after it's recorded, go to laeta.com and look at what they have to offer. Show people that you can change your life if you decide that you want to. You can do that, and when you're getting it directly from the people that run it on a day-to-day basis, but mostly executive directors before us today, because it's important to hear it from them, because they are in the operations 100%. They're in the 360-degree operations of this agency. And Ray has been at this for a while. He's a great person to really get to know as well, for the sake of just asking questions about, various other things, because, business is business, but sometimes business travels into other venues, and, you never know what you're going to need. So it's great to always talk to people. So I really thank you so much, Ray. This is awesome. We've known Laeta. I knew Laeta from the time it started, but I'm not going that far. I'm not going there. But I knew Laeta when it started, but I didn't really get to know Laeta until I met you, actually. So, I'm really grateful for the things that you've done, and, the thing with the women's business, that's a great thing. So I think a lot of women are looking forward to that. Jamila is she's amazing, totally amazing. So really glad that she's on board, and all the rest of the team that's on board. We're looking forward to what we're going to do in 2022. The sky's the limit at this point. If we get through COVID, we can get through anything. A
lot of people are realizing their W-2 job is no longer enough.
It's no longer. Nope.
COVID, they cut you quick. They cut you quick.
Yeah. I mean, people are beginning to wise up, and it's, sad that it happened this way, but they are beginning to wise up. And I'm finding out that, I even enjoy the fact that, having that ability to work from home, gave me everything that I wanted, because I was able to actually balance. It's hard to think at work about what you're doing at home when you're supposed to be working, and then at home you're thinking about work. So now I'm in the middle, so I can do both of them at the same time, and it works out for me. But I appreciate what Laeta brings, and I'm glad that they've been a partner with us, and we're hoping that going forward that this will continue doing what it has done, and that we'll continue helping small businesses develop and entrepreneurs flourish, and get young people into a place where maybe one day there'll be no jobs anymore. They'll just be businesses, and let people do what they got to do, and they'll be fine. So thank you again. Thank you so much. And I thank everybody that was on our panel this evening. All of our partners, Laeta, the Camden County Historical Society, Hope Works, and New Jersey Conservation. We thank all of them for being a part of it. We also thank the Walk Bike group that was with us, with Matt Ludwig and Lisa and Bill. We're looking forward to January, so we can talk to them more about what it is that we would like to see. We also thank Rich Brenner for coming to us with Medicare information and how to sign up and to get us ready for the 2022 season. Our next meeting will be on December 8th, 2021. It'll be our annual membership meeting. This meeting is basically for members only, but anyone can, actually attend, but it's actually our members meeting. And if you want to join in 2022, $12 for the year, go to www.pbcip.org, or you can call 856-964-0440 extension 13 and say that you would like to get a membership. But the online thing is the easiest. But if you don't do online, we can send you out a membership form. We also want to thank all of our members that were on tonight. DPW's Kyle Smith, that's my friend, that's my partner, that's my bud, that's my dude, that's it. Miss Marion Jones, thank you, Miss Marion, because you come in with the right stuff, asking the right questions and bringing the right information. I think that's Mr. Magruder. If I'm not mistaken, I only know one Maurice, so it may be Mr. Magruder, but if that is him, thank you so much, Mr. Magruder. Miss Pat, I saw you, Miss Pat Rogers, I saw you. Thank you so much for being on tonight. If there's anything that you need, let us know for whatever the future brings and everything. Shelly, I see you on there as well, and Keith. I thank you guys for being on. Spread the word. There's a lot going on. We got to share our knowledges. We need people to know what it is that we're doing. We need people to be with us. We need to be with them. Communities don't grow unless we network. If we don't network, we're not going to go anywhere. We're not going to go. It's like making a rubber band ball. You just keep on putting rubber bands on it until the ball gets really big. And that's what we're doing here. We're just making this giant rubber band ball so we can keep moving and do the things that we've been doing and make our quality of life better. Know that holidays are coming. Like I said, please be safe. Protect yourselves. That's your family, I know it, and you love them and they love you, but you want to see them next year. So please protect yourselves. If you want to get vaccinated, fine, that's fine. If you don't want to get vaccinated, fine, that's fine. But at least wear a mask, social distance, and wash your hands. If you did that last year, it kept you up until this year. It'll keep you up until next year. All you got to do is just follow the rules. I do see that someone has their hand raised. Trying to see who this is. Looks like Mr. Carter. Mr. Carter, you have your hand raised. Is there a question or did you do that accidentally? All right, it doesn't seem like he wants to say anything. Nope, he's leaving. All right, so I thank everyone and be safe. And Colin, it's good seeing you, man. Sitting down. I can't hear you. I can't hear you. How come you can't? Oh.
I said, thank you for inviting me. It was very educating. And I will look forward to the next one. I appreciate everything you do for everybody.
No problem. It's my pleasure. It is truly my pleasure. We do this together. All of us,
Yes,
we do it
we
together.
do.
So
yes,
let's all
do.
stay together, guys. We got 2022 to come, and it's a lot still left. We got a lot of time left. So be prayerful, be safe, be blessed, and be out. See you later. Bye.
Have a good one.